It healed anyway. 50,000 years ago, someone broke their leg. No cast. No antibiotics. No hospital. And the bone healed clean, we know because we found the skeleton. Healed bone like that doesn't happen by accident. It happens because somebody set that bone. Somebody fed that person while they couldn't hunt. Somebody kept them alive for weeks, maybe months, in a world with zero margin for error. Now imagine it's you. You're the one who fell. No radio. No rescue. No medicine cabinet, just the people around you, deciding whether you're worth the cost of keeping alive. Medicine didn't start in a lab. It started around a fire, tens of thousands of years before anyone wrote a single word down. And by the end of this video, you'll understand why some scientists now argue that organized care for the sick might be one of the oldest human inventions there is. Older than the wheel. Older than farming. So how did people with no microscopes, no germ theory, and no idea what a virus even was, keep each other alive long enough for us to exist at all? The answer isn't a cure. It's a choice, to spend food, safety, and time on someone who couldn't pay any of it back, a choice almost no other animal on Earth makes. In most of the animal kingdom, an injured individual is a liability. A wolf with a shattered leg doesn't get carried. It gets left. Humans did something different. That skeleton with the healed leg isn't an isolated case. Archaeologists have found dozens of similar cases. Ice Age Europe. The deserts of the Levant. River valleys in Asia. Different climates, different cultures, thousands of years apart, and the same pattern shows up again and again. Someone got hurt badly enough that they should have died. And they didn't. Why would that keep happening, over and over, in places these people never met each other? And this is only the beginning of how strange it gets. If ancient humans could pull this off with nothing but stone tools and observation, wait until you hear what they were willing to try next. Subscribe now, the next part is where this gets genuinely hard to believe. A tooth. A hole drilled straight through the enamel. That's what archaeologists found at Mehrgarh, a burial site in what's now Pakistan, dating back roughly 9,000 years. Small, precise holes cut into decayed teeth using nothing but a sharpened stone tool. Someone sat still while another person worked on their teeth with a rock. And they survived it. Thousands of years before dentistry was supposed to exist. Sites like this changed how scientists think about early humans entirely. For a long time, the assumption was that people just endured pain and died young. But the fractures tell a different story. Severed limbs that healed. Ribs that knit back together. Injury so severe no one could have survived them alone. This is where the story flips. Ancient humans weren't just reacting to sickness. They were problem-solving it. Which raises the obvious question. Where did they even get the knowledge to try? Picture this, repeated for generations. A mother chews a bitter, foul-tasting leaf that has 0 calories and no nutritional value, and hands it to her sick child anyway. Early humans had to learn, through direct experience, which plants soothed pain, which stopped bleeding, which caused vomiting, and which could kill you outright. That's generations of tested, refined knowledge, a library with no books, passed mouth to mouth. Some of it is older than our species. At the El Sidrón cave site in Spain, researchers analyzing hardened dental plaque from Neanderthal remains found traces of chamomile and yarrow, plants with no nutritional value, but with known medicinal and pain-relieving properties. A species that went extinct tens of thousands of years ago may have already understood the basics of a painkiller. If a plant could ease pain, what happens when pain isn't the problem? When it's something inside the skull itself, what would you do if someone in your group had unbearable head pain, seizures, or pressure building inside their skull, and you had no idea why? Some ancient humans cut a hole in it. The procedure is called trepanation. And archaeologists have found prehistoric skulls, some over 7,000 years old, found at sites across Europe and later in Peru, with precise, clean-edged holes carved into the bone using nothing but sharpened stone. In a striking number of cases, the bone shows signs of healing afterward. That means the patient survived the surgery. Let that sit for a second. Someone, with a stone tool and zero understanding of infection or anatomy as we know it, cut into another human being's skull, and that person lived long enough for the bone to start regrowing. We don't know exactly why they did it. Some theories point to treating head trauma or seizures. Others suggest a spiritual or social meaning, a way of releasing whatever was believed to be causing the suffering. Possibly both are true at once. But whatever the reasoning, the outcome tells us something remarkable. Prehistoric humans were willing to attempt the most extreme intervention imaginable, and often, it worked. There's a skeleton archaeologists call Shanidar 1, found in a cave in northern Iraq, that might be the clearest evidence of all this we have. He was an older man, old, for that time. He was blind in one eye. His right arm had withered away, likely amputated at the elbow decades before he died. He had healed fractures throughout his body and signs of hearing loss. On his own, this man could not have hunted. He probably couldn't have defended himself, and yet he lived for years, maybe decades, after his injuries. Which means, for years, other people fed him, protected him, and made room for him. Imagine being the one everyone else decided was still worth feeding. None of it works without a group willing to keep a non-productive member alive. Food shared, even when there wasn't enough. Protection for someone who couldn't fight. Time pulled away from hunting, gathering, surviving. And they paid that cost anyway, not once, but over and over, for tens of thousands of years, across completely different environments and cultures. That's not an accident. That's a strategy, maybe the single most important survival strategy our species ever developed. Not stronger muscles. Not sharper claws. Cooperation. But cooperation wasn't the only tool they had. Their own bodies were built for this too. A fever isn't your body malfunctioning. It's your body doing exactly what it's supposed to. When you spike a temperature, that's your immune system deliberately raising your internal heat because many harmful pathogens struggle to survive above a certain threshold. Feeling miserable is often a sign that your body is winning. Ancient humans didn't understand the biology behind this, but many cultures independently arrived at similar responses anyway: warmth, rest, fluids, isolation from the group. Practices that, without anyone knowing the underlying science, happened to support the exact process the body needed. That's the pattern behind almost everything in this video. People without microscopes kept arriving at solutions modern medicine would later prove correct, not because they were guessing blindly, but because natural selection and generations of close observation were doing some of the science for them. Let's go back to that broken leg from the beginning. That healed bone isn't just a curiosity, it's a message, passed across 50,000 years, from people who had every reason to leave the weak behind and chose not to. They didn't have antibiotics. They didn't have anesthesia. What they had was each other, and a fierce, practical determination to keep their people alive. Every time you take medicine, see a doctor, or simply help someone who's sick, you're not doing something new. You're continuing the oldest tradition our species has. We didn't invent medicine. We inherited it. And it's still being written. If this changed how you see human history, subscribe. I'm covering more stories like this, the ones that don't make it into the textbooks. And drop a comment, which part surprised you most, the surgery or the fever? I read every one.